Welcome, everyone. Thank you for taking time out of your, what I'm sure is a busy but hopefully relaxing summer. Um, a lot of folks are on vacation, so we may have a very nice, intimate meeting today, but you're really in for a treat. Let me pull up my slides. Are you all able to see that? Well, we are really thrilled to bring this incredible learning collaborative to a close with this capstone event. As you all know, this is the last webinar in our series on sustaining respite. I think we all know each other, but if you feel like you'd like to, please put your name, agency, and state in the chat and say hello. And I'm sure we'll have some time at the end for a more informal discussion. I want to start off by especially giving a great shout out and thanks to Susan Summers with Arch, who is on the call, but she's not able to unmute herself at the moment because she's having quite a bit of background noise from the Blue Angels, which is a Navy flight demonstration squadron that is holding its, I guess, its annual air show in Seattle. So every once in a while, she can't even hear us. So she's going to stay on mute during this last meeting. But I did want to acknowledge just all of the work Susan has done in this space. She authored our first report on lessons learned in sustainability planning for respite back in, I don't know, 2015 or 2016. And she's been expertly facilitating the Sustainability Learning Collaborative now for 7 or 8 years. And along with the amazing Learning Collaborative members, conceived of and organized this webinar series on sustaining respite to showcase all the work that's been accomplished by the grantees. And we couldn't have done all this work without Susan, without all of you who participated on the collaborative. So many thanks to her and to all the grantees and partners and all of you who participated. Thank you so much. Before we get started, I just have a couple of quick announcements. I absolutely want to be sure that you all saw the notice of funding opportunity for the 3-year state lifespan respite enhancement grants that was finally released by ACL on Monday. Its current and former state lifespan respite grantees are eligible, at least from my reading of it. But please note there is an extremely short time frame in which to respond. Applications are due August 15th. I sent you all an email on Monday that had more details. It's also posted on the ACL website and on the Arch website, and I'll put a link to all of these in the about the announcement in the chat in just a minute. Unfortunately, I can't answer any of your questions about the funding opportunity today. I'm not permitted to do that. You'll have to direct any questions you might have about it to ACL directly. And the email where to send your questions is in the notice of funding opportunity announcement as well. I'm also excited to share with you, and I sent this around to all of you before today, an updated Arch resource, financing strategies for lifespan respite grantees, state respite coalitions, and provider agencies. As you all know, sustainability planning involves a multi-stage strategic process with lots of ongoing and related action steps, and lots of different considerations have to be taken account of. And these are the topics that the Sustainability Collaborative really tackled over the years, multiple issues, and they're all outlined in this document. But I think we can agree that financing is always of primary concern to everyone working to sustain their activities, especially in this current environment. Christina was just addressing that directly about how she's now thinking outside the box for funding. And we're very glad that we're able to share this tool with you as we close out this webinar series on sustaining respite. The timing seemed quite perfect. I did want to show you what it looks like on the website. And I want to thank all of you who shared all the financial strategies for sustainability for use in this tool. We did a survey and so many of you responded with your great activities. And we had so many incredible examples that we decided to post them online rather than forcing you to read a very long PDF document. It'll make it easier to update in the future as well. And so you can access all the specific state and local examples of successful financing strategies on the Arch website. And if you click on each of the major financing strategies on each of these orange tabs on the Arch website, you will see different approaches with corresponding state and community actions that can be taken and have been taken by many of your colleagues and others in the private sector to advance their sustainability work. Again, I'll put the links to all of this in the chat. Does anyone have any questions on this particular resource? Nope. If you could take time to go through it and you have any questions, don't hesitate to reach out to me. I'm happy to talk to you about it. I am really excited today to introduce our presenter to you, who I think really needs no introduction. I'm sure most of you know her from her leadership on the Sustainability Planning Collaborative, from many other wonderful presentations she's done for the Respite Network in the past, and most recently as our host for the last National Lifespan Respite Conference in Huntsville last April, that amazing conference. And given that Alabama Lifespan Respite Network is celebrating their 25th year, which is just incredible, as one of the first state lifespan respite programs that actually served as a model for the federal legislation, I think there really is no one more qualified to talk about long-term sustainability in respite than Tracy Cieniewicz. And so no one better to really conclude this webinar series. So thank you so much, Tracy, once again for responding to the call to share your great work. And I will turn it over to you.
Well, thank you, Jill. Thank you so much. I appreciate those kind words more than you know. If we can go to the next slide, please. So again, I am Tracy Cieniewicz, and I'm the director of Alabama Lifespan Respite, a statewide program of UCP Huntsville. UCP Huntsville and Alabama Lifespan Respite have partnered with the Alabama Department of Senior Services since 2009 to fulfill activities of multiple ACL Lifespan Respite grants. And we are proud to be a longtime member of ARCH. So thank you to Susan and Jill for inviting me to share insights today into our program's 25-year growth and our ongoing journey towards sustainability. Next slide. So wherever you are in your respite program journey, whether just starting out or seasoned leaders in the field or somewhere in between, I hope you find value in the information I share today, specifically about our program's journey. My own family caregiving journey started when I was 15, and I was a temporary caregiver for my dad while he recovered from open heart surgery. As an adult, I've provided respite to my mom and aunt, who were full-time caregivers to my grandmother in the last few years of her life, and my sister-in-law and mom, who were full-time caregivers to my brother in the last year of his life. While I've never been a full-time caregiver myself, I've seen firsthand the physical, emotional, spiritual, and emotional and financial toll caregiving can take on a person, not only through the selfless, strong, incredible caregivers in my own family, but also the numerous family caregivers of children and adults with disabilities and chronic illnesses that I've been fortunate to work alongside in my 18 years at UCP Huntsville. I have also seen how rewarding and fulfilling caregiving can be, especially for those like my mother who possesses the inherent qualities of a natural caregiver. In my professional journey, I've served primarily in fundraising, development, and grant writing roles, which you know is nonprofit way to say I had the pleasure of wearing a whole lot of hats here at UCP Huntsville for 11 years prior to becoming the director of our statewide Alabama Lifespan Respite Program 7.5 years ago. UCP Huntsville CEO Cheryl Smith has been a phenomenal mentor from the beginning, and she helped me to step into my current role, overwhelming as it was in the beginning, by being patient and generous with her wisdom and experience. I hope each of you have a Cheryl, and I also hope that you enjoy the journey toward developing and maintaining resources for your respite program sustainability. Next slide. To provide an overview of Alabama Lifespan Respite's resources for sustainability from the ground up, we have to start 62 years ago and discuss how and why the journey began. But I promise to keep it brief and just share an overview of our organization and our two respite programs that you see here. Next slide. So, when our parent organization, United Cerebral Palsy of UCP of Huntsville and Tennessee Valley, now we just call it UCP Huntsville usually. When it was established as a nonprofit in 1963, we exclusively served children with cerebral palsy and those with severe physical disabilities through outpatient services like physical occupational speech therapies. There was also a program like a Mother's Morning Out program at that time. UCP Huntsville operated from a small house in Huntsville's medical district, and just a handful of staff served a limited number of families across 5 North Alabama counties. So the information you see on the left here represents where we started. But today, UCP Huntsville serves children and adults of all abilities who represent nearly 200 diagnoses, including developmental delays and sports-related injuries, their families, and the education, healthcare, and community professionals who work alongside them. Our agency has 2 regional centers and nearly 40 staff members who represent 9 individual local and statewide programs under the UCP Huntsville umbrella. Together, we now serve more than 15,000 children and adults statewide annually. So this tremendous growth did not happen overnight, and it did not happen by chance. UCP Huntsville has always had a very robust and active board of directors, but much of our agency's success must be attributed to our CEO, Cheryl Smith. Cheryl was, I believe, 26 years old and a board member for UCP, who stepped in as interim executive director in 1986, and she has never looked back. While event-based fundraising and donor development does help to sustain our children's therapy services program, our remaining programs are entirely funded by contract partnerships and reoccurring grant opportunities with state and local agencies that Cheryl and our team have identified, cultivated, and carefully nurtured over about 39 years. One of the first of these longstanding partnerships resulted in the establishment of our Hearts Respite program in 1994. Cheryl and our pediatric therapy staff saw the need for respite while working with families in our growing outpatient program, and they applied for funding from the Alabama Department of Child Abuse and Neglect Prevention Children's Trust Fund to provide voucher respite, caregiver education, and first aid training to parents and guardians of children up to age 19 with any special health care need who lived in our legislative district. Next slide. So, HEARTS, which stands for Health Emergency and Respite Treatment Service, was so impactful that by 2015 it had been successfully replicated by all 5 UCP Alabama affiliates and is now available to families in all 67 counties in Alabama. Furthermore, ARCH recognized HEARTS as an innovative and exemplary respite service in 2022. Funding for each HEARTS program continues with regular increased support from the Alabama Department of Child Abuse and Neglect Prevention Children's Trust Fund. And our HEARTS program here at UCP Huntsville currently receives about $200,000 annually in funding. Next slide. So, oops, I think there we go. There one in between. Nope. During the innovative and exemplary respite service interview process, my colleague Stephanie Wright, who manages the Hearts program, and I shared with Susan Summers that Alabama Lifespan Respite exists because of the success of Hearts. And I remember how surprised Susan was because, and Susan, correct me if I'm wrong, we had quite unintentionally failed to ever mention the connection between the 2 programs when talking about Alabama Lifespan Respite with Arch and our partners all these years. Because of Hearts, our CEO, Cheryl Smith, and UCP leadership recognized the need for respite and caregiver supports for those beyond the age 19 and established Alabama Lifespan Respite in 2000 to figure out how to reach those families who are not being served by Hearts or other respite programs. Next slide. Like UCP Huntsville and the Hearts Respite Program, Alabama Lifespan Respite started small and growth took time. This timeline you see here is a snapshot of the process to increase access to and availability of respite resources for all Alabama caregivers. And the process wasn't easy or straightforward. The first step was to gather the collaborative partners UCP Huntsville and Hearts had been working with for almost 4 decades to identify the respite needs of caregivers in Alabama and the gaps and barriers they face to access respite services. So, a task force of 45 volunteers assembled from state agencies and nonprofit and for profit agencies that serve individuals with special health care needs and their families. Their work resulted in consistent advocacy from a group of strong voices, and 6 years later, that advocacy resulted in a state appropriation from the Alabama Education Trust Fund to allow Alabama Lifespan Respite to fund the work we had already begun doing to provide respite education and awareness activities to support caregivers statewide. It also laid the groundwork for incremental progress toward increasing respite services in the future. Our next milestone was in 2007, even though I know on the slide it says 2009, sorry. But in 2007, when the Alabama Department of Mental Health, which served on the task force, presented us with the opportunity to diversify our funding through a contract partnership. This allowed us to utilize their funds to deliver voucher respite reimbursement to caregivers statewide of children and adults with intellectual disabilities. We did all this through our program with their funds. This is a partnership that continues today and has served as a model for subsequent contract partnerships, which have helped us to build a lasting respite infrastructure by creating revenue through administrative fees. And as you can see, 2009 was a big year for Alabama Lifespan Respite. The Alabama legislature passed a resolution in 2009 establishing Alabama Lifespan Respite as the lead entity for respite coordination in Alabama and designated us as the coordinator or staffing entity to the governor appointed Alabama Lifespan Respite Coalition, which I'll share a little bit more about in a few minutes. From that effort, the Alabama Lifespan Respite Resource Network Act was passed into law in 2012. And if you're interested in reading this legislation, it's available on our website and also on Arch's website, but I'll be glad to email it to you as well, email you those links or drop it into the chat. So this helped to solidify our annual state appropriation, and it opened the door for federal funding that served as match when we were awarded our first ACL Lifespan Respite Grant in 2009 in partnership with the Alabama Department of Senior Services, who had also been part of that task force. Next slide. Since 2009, Alabama Lifespan Respite has primarily utilized ACL Lifespan Respite Grant funds to provide planned and emergency voucher respite reimbursement and supports to caregivers who do not qualify for other respite assistance. Our strong collaborative partnerships have presented opportunities for additional respite funding, as outlined here, that have helped to create a long-term path towards sustainability. I do want to stress, though, it's just important to stress these partnerships are not just a paperwork process or relationship, but they are a mutually beneficial partnership for all caregivers, as are evidenced in our robust services and supports. Next slide. Today, through ACL grants and contract partnerships with 19 state agencies, highlighted here in yellow, those two different things, our respite funds and their respite funds, Alabama Lifespan Respite serves about 2,000 caregivers statewide through planned and emergency voucher respite reimbursement. Our voucher program is personal choice or self-directed, different people call it different things, but that's because we do not employ direct service providers and we do not coordinate volunteer respite providers. With our program, caregivers may choose anyone over the age of 18 who lives outside of their home to give them a break. Most areas of Alabama are very rural, so this affords a great amount of flexibility when choosing a respite provider for caregivers who may not have access to agency-based direct service providers. Additionally, state funds that serve as match to federal dollars allow Alabama Lifespan Respite to provide caregiver education, respite provider training, awareness, resource and referral information, technical assistance for community respite startup and expansion, mental health counseling and supports through the Caregiver Wellness Initiative, and advocacy. Regardless of your respite reimbursement program enrollment, whether it be with Alabama Lifespan Respite directly, one of our contract partners, or even not at all, each of the services listed here is free and available to all caregivers in all 67 counties of Alabama. Next slide. It took a long time for us to be able to offer this level of services and support to caregivers, and the journey has not been without challenges. Like in 2016, when Alabama Lifespan Respite was not awarded an ACL Lifespan Respite grant. To be honest, this was a year when UCP Huntsville was taking a hard look at whether or not it was financially feasible for Alabama Lifespan Respite to continue offering all we offered statewide. Our future was a little uncertain, which led to a concerted effort to find a better path forward to sustainability. Thankfully, our close partnership with the Alabama Department of Senior Services opened the door to contract with each of 13 area agencies on aging, AAAs, in the state. Increased contract partnerships created revenue that allowed us to maintain staff and grow services. However, it wasn't as easy as signing a contract and cutting checks to caregivers. We had to establish individual scopes of service with each agency, create collateral materials, build a new database that could handle all of the new information we were collecting, and adjust staff duties and responsibilities. The biggest challenge was to establish trust and personal relationships with caregivers who didn't understand why their AAA in rural southern Alabama was sending their paperwork to an unknown agency up north in Huntsville. But again, thankfully, our partnerships with the AAAs opened the door to allow Alabama Lifespan Respite to attend community events and present caregiver education alongside AAA staff statewide. So this increased our reach and built trust and recognition in those communities with the caregivers they were already serving. Next slide. The success of Alabama Lifespan Respite has clearly hinged directly on our collaborative partnerships, and none is more vital than the governor-appointed Alabama Lifespan Respite Coalition that was established by legislation in 2009. Next slide. I'll be the first to say there is often confusion, especially from other states who contact us about our respite model, about why our state has both entities. While some respite coalitions may provide direct respite services and supports, the Alabama Lifespan Respite Coalition exists for collaborative partners statewide to work together in support of caregivers and limit duplication of effort when addressing gaps in caregiver resources. UCP Huntsville's Alabama Lifespan Respite Program, which provides direct respite services and supports, serves as staffing entity to the coalition and helps foster communication between its members. The coalition is not funded, but our staffing role is funded through that state appropriation. Next slide. So our coalition members serve 3-year terms, and their duties include building partnerships and coordinating respite efforts statewide, preparing Alabama to compete for federal funding, providing public awareness about respite to the citizens of Alabama, identifying, coordinating, and developing community resources, and building local partnerships and collaborations supporting respite services. Next slide. Per legislation, the agencies you see here and individuals represent the seats to be filled by governor appointment to the coalition. So from legislators to family caregivers, the coalition is very diverse and represents a wealth of knowledge, passion, and experience to benefit family caregivers statewide. I'm going to leave this here for just a second and let y'all look at it. A lot of people are always interested in those seat appointments. Like I said, it's varied. If you look at the collaborative training partner, That one is changes a lot. It can be, a variety of different agencies can represent that collaborative training partner seat, as well as the statewide advocacy organization. Currently, it's Alabama Head Injury Foundation, but those seats are kind of open to other groups as opposed to these state agencies that are always appointed. Next slide. Since it was established 16 years ago, the Alabama Lifespan Respite Coalition has written and presented 2 white papers to educate legislators about the need for and importance of respite. And those efforts have directly resulted in increased state funding for respite education and awareness. We started at $100,000. Our first appropriation was $100,000 annually, and currently it's $315,000 annually. And we credit a lot of that to our coalition. I've already mentioned the numerous contract partnership opportunities, but many resource opportunities have been created as well. For example, almost every goal and objective in the Alabama Department of Senior Services State Plan on Aging for 2025 through 2028 includes Alabama Lifespan Respite. And we are the first non-state agency to receive referrals through Peer Place with the Aging and Disability Resource Center, the ADRC's One Door Alabama Universal Intake Program. Most importantly, coalition members have worked hard to increase Alabama Lifespan Respite's reach to family caregivers statewide by promoting our program and services through their own agencies and communities. Next slide. While Alabama Lifespan Respite has worked hard for 25 years to increase our sustainability, foundational threats still remain. These are just a few, but the most pressing currently is a potential shift in legislative priorities. As I said, our annual state appropriation is through the Alabama Education Trust Fund budget, as opposed to the general fund budget. With possible federal education funding changes looming, less support may be available in the Education Trust Fund budget for respite education and awareness activities. Additionally, 15 of our contract partners are area agencies on aging who receive Older Americans Act funding. If the respite funding they contract with us to administer to their caregivers for personal choice option respite through our voucher respite reimbursement program, if it decreases, so do our administrative fees that we collect. So that revenue will decrease as well. Therefore, we rely again on our coalition to advocate for at least level funding, and we encourage caregivers to share their stories with legislators because their voices matter most. I included lack of coalition participation and support as a foundational threat here because, as I have shared, we rely heavily on our collaborative partnerships with coalition members to sustain and grow the Alabama Lifespan Respite Program. Just like any board, task force, or coalition, it goes without saying, some people are just fulfilling a requirement or are there in an ex officio capacity. And that's the very Southern way of saying just because the governor appointed you doesn't mean you really want to or have time to participate. So to that end, the coalition does have a practice in place that allows each member to designate someone within their organization to attend meetings on their behalf and report back to them. The designee is often someone who understands respite and in turn can help the appointed coalition member better understand and support the activities of the coalition. However, if neither the member nor their designee is connected to the cause, we do run the risk of losing the support of an entire agency. Therefore, coalition member engagement is essential to our success. Next slide. So, through resilience and determination, intentional effort and collaboration, the journey continues for Alabama Lifespan Respite. What started in a little house in Huntsville 62 years ago, serving a small group of families of children with cerebral palsy, has grown into a statewide program with numerous supporters and partners working together for the benefit of all family caregivers. statewide. Next slide. 25 years into this wonderful journey, Alabama Lifespan Respite serves more than 2,000 caregivers statewide through voucher respite reimbursement and a lot more through caregiver education, mental health counseling and supports, awareness, resources, and so much more. We started small and faced uncertainty more than once along the way, but we are currently the largest of UCP Huntsville's 9 local and statewide programs with a healthy annual budget of nearly $2 million to serve caregivers statewide. One contract partnership has grown to 19 and counting as we prepare to add a new contract partner specifically for caregiver mental health counseling in fiscal year 26. And our program continues to grow as we identify and respond to caregiver needs. And I am truly honored to have been entrusted with the leadership and direction of this program, and I'm excited to see what the next 25 years bring. Next slide. So this is just an overview of our respite program's journey toward developing and maintaining resources towards sustainability. But I do hope I have shared something today that will be helpful in your program's journey. If you have any questions or comments about anything I've shared, I'm ready to discuss. And thank you, for all for joining us today. I appreciate your time. And if you ever want to reach out to myself or anyone on the team, please do so. You can email me here or give us a call or visit us on our website at alabamarespite.org. And good luck with your programs.
Thank you so much, Tracy. Every time I think that I know everything there is to know about your program, I learn so much more. That was really incredible. Thank you so much. I feel especially honored also because you mentioned the Hearts program that started with a grant from the Child Abuse Prevention Trust Fund. And that was something I was also intimately involved with initially, having written the legislation for that program back in, I don't know what year it was, 1986 or something. So it just feels such a wonderful closure to the Sustainability Planning Learning Collaborative, but it's not really a closure. We'll continue to dialogue, share information, be available as Tracy will. So thank you so much, Tracy. That was truly incredible. We're happy now to open it up to any questions or comments that anybody might have. Please feel free to unmute yourselves if you'd like, or put it in the chat. I think we have some comments in the chat here. Let me see what we've got. Oh, just lots of thank yous and good lessons learned. Any questions?
Cheryl Donnell. I've got some instability on my video, so I turned the video off just in case, so I don't freeze up or anything too. I had a question. You were talking about that new relationship with the state of Alabama, and how you said mental health was the partner. So was there a connection to UCP's activities that mental health had a role in? How did that connection come to be?
The very first funding that we got in 2007, or the new contract that we're going to do for mental health?
No, the first one.
The first one, yes. So they did serve on the task force, and they were one of our partners that served on the task force when Alabama Lifespan Respite was forming. So they were just one of those agencies, and because they were aware of what we were trying to do, it's my understanding. I wasn't a part of that, but it's my understanding, the history lessons that I've received over the years, that they had funds available, and reached out to us to see if it was something we would like to do, is administer those funds specifically for families they would be serving. So individuals with intellectual disabilities, those caregivers. And so we have two different pots of funding through that partnership. We have Departmental Health DMH child funding and DMH adult funding. And child goes up to age 19, and of course, adults 19 and beyond. And so what we do is we get a contract every year, and it has X amount of dollars for each funding stream for adult and child. And then we administer those funds. We usually send three vouchers out, respite reimbursement vouchers out to those families. But we do all the intake for it. So we have a universal respite application, and based on the information that they provide us and the proof of diagnosis, that's how we determine that those individuals will go on to those funding streams and not to our universal respite, like from our ACL funding. And a lot of times those families might qualify for hearts too, for hearts respite. So if we see that it's somebody local and in our legislative district, we might direct them to Stephanie to our hearts program instead of utilizing those funds, from DMH. But there again, when we do that, all of those caregivers have access to all of the respite resources that we offer through Alabama Lifespan Respite.
Tracy, this is Cheryl again. Just a follow-up then. I'm just trying to help me figure out how this came together. So they had a respite priority, or they had funding for respite, or because of your awareness in your task force, they became aware of the need for respite and said, oh, we want to put a focus on respite. Maybe you don't know whether that takes.
Yeah, and I think Cheryl's on the call. Cheryl Smith, she might be able to speak more a little to that if she can jump on. But I mean, yeah, I think it's a little bit of all the above. They were participating in the task force, so they were aware of the need. Funding became available and they saw an opportunity. Is that right, Cheryl?
One of our original partners, and intrigued about what respite might be. And through our awareness, obviously, and working closely with the department anyway, they saw what our families were going through, and they were eager to be one of the original members. And then we challenged our members for any opportunity that they saw potential funding. And so it took a couple of years, but the more we messaged, the more they worked on how to establish respite as a statewide sustainable program. Prior to ACL awarding those funds, we were, still early. I think we had a 3-year startup grant, and we had to sustain it after that. And so I think that's about the time everybody on the coalition was really looking hard for how can we keep this program going, and they stepped up first. So.
Yeah. And what's great about that partnership, I mean, we send them, of course, reports and everything about who they're serving and at what level, and how, we are coming in with wraparound services to support those families that their funds are serving. So just a few months ago, the deputy commissioner called me up and said, hey, we have access to some Children's First Trust Fund, which is the tobacco settlement funds that we've been legislatively appropriated, and we would like to share those with you for DMH Child. And so we got a bump, and so and 100% of that, a lot of that goes directly to the caregiver, minus that small administrative fee, goes directly to the caregiver. So those caregivers who were not expecting much respite reimbursement for the last 2 quarters got a nice increase, and we're very happy about it. And we were very happy to deliver that to them. And it just so happened to go out with our respite satisfaction survey. The timing aligned, so we got lots of positive feedback about getting that little bump from DMH funds. So that was nice alignment, and but it was nice that they thought of us first instead of going to another agency, which they could have done. They could have spent that money in a million different ways, but they called us first to see if it was something we could utilize with the caregivers that we serve through their funds.
If I could also just add my own perception of early stages of Alabama Lifespan Respite and that initial coalition. From the get-go, with Cheryl at the helm and several other incredible people who were movers and shakers and made sure that everyone in every state agency knew about respite and was connected. They were constantly engaging. And in many ways, so much of this comes down to relationships and relationship building. And they were expert at it, from Cheryl to the original team. And I think they've handed down that ethic, that advocacy ethic since 2000 when this first got started. And I really attribute so much of that early success to never letting up, always contacting people, always raising awareness, always educating. In fact, I love this one story that I have to share with you about advocacy. We were holding a state lifespan respite summit before the federal law was even passed or hadn't been funded yet in 2006 or 2007. We held a lifespan respite summit in Alabama, and we held it across the street from the state capitol. And during the break, they walked us across the street, everybody at the summit, to lobby their representatives while we were there in the middle of the summit about ongoing funding and continued funding for Alabama respite. So there was always that passion, that energy, that connection to everybody who mattered, and they knew who mattered, and they were connected. And so much of that is attributable to Cheryl's leadership and her team at that time that were just truly amazing. I can't say enough about that.
Yeah. Cheryl's great at visiting at the Capitol.
Well, I appreciate the kind words. It takes a team, and I really want to stress that on sustainability. It's not one person, it's collective voices of our caregivers and some very passionate people to share those stories when our caregivers can't be there face to face. But video now really helps share those stories. So I really challenge you to, get those stories if you can in video or in words, and to share those with your policymakers. But, Tracy was I guess, it didn't just fall in our laps. It took a lot of her efforts as well. A lot of these things, you have to plant the seed of the need, and it may take years, but you just keep at it and you keep at it and you tell them. And I know this last bump with mental health, they did call us. That was great, but it was because of the professional staff, the reporting back on the difference the money makes. We had made comments that we felt like our caregivers needed more funding in the next year with various concerns as to why. And it's just that constant messaging. And Tracy's just so good at keeping that torch going. I've passed it over to her mostly, so I appreciate the kind words, but it's her team that's taken that and really carried that passion forward, and the voices of our caregivers. So, but it takes hard work. It's not make a call and it'll happen. It takes years of constant reminding them, and then when that moment comes, they say, "Oh, I remember, Tracy said something about needing money," and so they do think of you if you're very visible. Periodically, we don't have money to go to Montgomery a lot, but we do try to strategically time being in the right place at the right time so that they never forget us. So that's what your challenge is now.
Thank you, Cheryl. Caitlin has been raising her hand for a while, very patiently. So Caitlin, go ahead with your question.
Sure. Thanks, Jill. Something that we're thinking about, or something that's been heavy on my heart here, is especially in the current funding situation we might all find ourselves in. We see respite. The need is obviously there, and here in Delaware, folks are accessing it at a greater level, which is exciting. But something that I was curious if you could speak a little bit about, Tracy, is in the early days, as you were growing, we sometimes feel pushback about looking at the admin cost of running the respite program versus the actual dollars that are directly going to clients. And so how do you manage, or how do you make sure that, folks understand kind of the build-up process and then the continuation process, right? Because to build the system takes time, somebody
Mhm.
has to be in the seat to get the vouchers out the door, or however that looks. How
Sure.
did you negotiate that with your coalition and with your funders?
We are in a very fortunate situation. I will have to say that state appropriation that I talked about that covers our administrative fees, and that is our match to our federal dollars. So when we get an ACL lifespan respite grant, for example, all the admin is on those state dollars, and so everything goes directly towards caregiver services and stuff with the grant. Um, and again, those contract partnerships, that's a revenue source for us. So the revenue generated by all of those entities who contract with us to deliver their respite funding to their caregivers, then that's what pays for staffing for those purposes. So, like I said, we're in a fortunate situation, I guess, where we don't have to explain that a lot, I guess. And again, Cheryl might be able to speak more to that. But yeah, those state dollars are for that admin purpose, and we're lucky to just have that annual appropriation again with a lot of support from our coalition and a lot of legwork on our part to like Cheryl said, to remain visible. Um, we're able to carry out our administrative duties through that state support and those contract partnership revenues.
Thank you.
Mhm.
Thank you.
Tracy, I'm going to try and take this moment of relative silence to just also make an observation that you give data information back to people. So, I mean, one of the things that always struck me about Alabama is that you're so visibly responsible and accountable that, I mean, you have great credibility because you come through. And I think a lot of us feel like, oh, sorry, they're coming, that we're going begging. But I think Alabama, you're offering this really valuable product. It's so apparent. And I don't know if you did that intentionally, but if you can kind of talk about your philosophy about that and what you do to make everybody know that you're good value. And I'm
Well,
going to
thank
mute
you.
myself.
Okay. Yeah, thank you for pointing that out, Susan. Yeah, we do. We coming from the fundraising background, I did feel like I was begging all the time. When you're doing that event-based and donor development kind of fund seeking, it's a completely different ball game. But coming into Alabama Respite, like I said, you're right. We have great services and we're always developing new services. I love having the flexibility to be responsive to caregiver needs and to just be able, I mean, if we see something emerging, a need emerging that, our caregivers are all coming to us and saying, I need this, to be able to respond to that quickly is so wonderful because, in nonprofit, that's not always the case. You may have to, there is a lot of planning and a lot of negotiating and a lot of fundraising and everything to get a new program or a new initiative started. With Alabama Lifespan Respite, we've just had, like I said, great flexibility to be able to do that. And because of those collaborative partnerships, that's what sustains that. So we're able to go to a collaborative partner and say, hey, this is a need. What can we do to make this happen? And because we do have that history of delivering what we've said we're going to do, they're more responsive. And it doesn't feel like a begging situation at all. We do feel like we're coming to them with good information. Like you said, we do provide data. I feel like I do reports all the time. But they know we're going to do what we say we're going to do, and they're responsive to help us because we're there to help them. I don't know how many times I've said to, especially our partners, the Alabama Department of Senior Services, we always try to say yes. That is, no matter what they ask us, I'll say we're going to try to say yes. And so I think our partners appreciate that and find value in it. Oh, Cheryl's muted.
We came as a nonprofit from that point of view that we've always had to measure what we do whether it's contracts or grants or whatever. So we entered Respite with that mindset that if it wasn't documented, it didn't happen. So literally you have to tell your stories, because we're a very conservative state. Our best support is our Republican leadership because they're a super majority in our state. So showing that it makes a difference, having the stories, but also having the numbers, the economic impacts. One of our best champions is Overlife long-term Medicaid division. And, you know, everyone we can keep in the home means we're not spending it on more costly out-of-home placements. And so she even personally shared with some of the leadership on a grant that they mutually were on regarding Respite about how much she supports Alabama Respite, because when we do what we say, but it's a cost-effective way as we have an aging society to address these needs when there's obviously a shortage of help. So our best support, I don't want anyone to be discouraged in our current situation, while not ideal. You know, there are still advocates out there if we can find them, and, you know, just give them the data, and through numbers and our, you know, faces and our stories. But numbers are very important, and we've just always grown up with that, coming from a nonprofit culture.
Yes, the data, very important. Data and stories, hand in hand. Any other questions or comments?
And then it didn't hurt that we had an early policy person that she was an individual with a disability, and she would roll down the hill going 100 miles an hour when she saw the governor chasing him down, and he was not going to refuse, you know, to speak to her. So we opened some doors, some creative ways, just because we were all passionate in Montgomery, but Linda had a way to get indoors that the rest of us were like, oh my gosh, you know, I can't believe he stopped to talk to us in the hall. So it does help to be lucky sometimes.
Yeah, she's the one who dragged us across to the State House to corner the state legislature as they were taking a break. Yeah, it was an awesome experience. Anybody else? Any final thoughts from anyone?
I just want to say I'm a guest on this. I thoroughly have enjoyed listening. This is Tracy's presentation and her program now, but anyway, I just enjoyed listening in. I didn't mean to speak, but certainly feel free to call on us. I know Tracy is always willing to share anything we're doing, any insights, or, you know, help problem solve or brainstorm. So, you know, we love everyone in the network to be the stronger we are together, the stronger voice we can have in Washington. So please let us help you if we can. And thank you. I'm going to turn off my camera and be quiet now.
Yeah, I want to thank you both for your partnership. You've truly been leaders in the National Respite Network, and we know that we can count on you. And Tracy, your presentation was really excellent. Just a very wonderful overview of all you've accomplished over the last 25 years that got you where you are today. And I think it's a little bit of a sobering message to know that sustainability doesn't happen overnight. It is a long process with many deliberative, thoughtful, progressive steps that take a lot of commitment and engagement. It's not an easy thing to undertake. So your work is valued more than ever. So thank you again for sharing all of that. Any other closing words, Susan, that you'd like to make
Well,
to the
just
webinar series?
Yeah, enormous thanks to Tracy and to all the sustainability members. And if those of you who have been on all three calls, you'll just see these themes. Talina Ford from Oklahoma talked about leaderships and partnerships. And, you know, and then Doris and Abby and Dina from New York also talked about planning, but they demonstrated their partnerships in their presentation. So these 3 states could have talked about every one of these parts. You can't just, like Jill was saying, you can't just look at financing. You can't look at one piece. So, you know, the series just shows the strength of these states that are willing to commit to this over time. And the other thing that I just noticed again and again through my learning from Tracy is that the structure in Alabama, and you really see this in New York too. So you have the policymakers, the administrators and planners, and the close connections. These 3 groups of like caregivers, grassroots programs, they communicate with each other all the time. And I think that, like the data, increases your ability to tell a powerful story, to know what's going on. You can't be accountable and responsible if you don't really know what's going on at the grassroots level. So the way that they've structured their coalition, it's not just off here telling everybody what to do. There's this flow of information and everybody gets really smart and really committed through that. So, and again, it didn't happen overnight, right? So wherever you are, reach out to these folks for support and to learn and have heart going forward.
Well, thank you all very much,
Yeah.
and I hope you have a pleasant rest of your summer afternoon here. Thank you again, Tracy. And we will be in touch with all of you in the near future. Take care, everyone. Have a great day.
All right.